Hello to everyone. My name is Katrina Scott. I am the Academic Director of the Center for Research and Education on Violence Against Women and Children at Western University. The Learning Network and Knowledge Hub are two projects hosted by the Center, and they are proud, and we are proud, to co-organize and co-host this webinar series. The Learning Network is a knowledge mobilization initiative that bridges the gap between current gender-based violence research and practice knowledge and lived experience to strengthen the capacity of the GBV sector and movement. Mobilizing knowledge on gender-based violence is crucial for preventing violence in diverse communities, supporting survivors and allies, and promoting gender equity. The Knowledge Hub facilitates a trauma and violence-informed community of practice for projects conducting intervention programming and research for people who've experienced family violence, and it's funded by the Public Health Agency of Canada. To learn more about the Learning Network and the Knowledge Hub, please access their websites, and those links are posted in the chat. This webinar is also being co-hosted by the Alliance Against Violence and Adversity. I'm going to invite Sarah Yurchik to say a few words about AVA.
Hello, everyone. I'm Sarah Yursich, an early career researcher with the Alliance Against Violence and Adversity, also known as AVA, as well as lead on AVA's webinar series and co-director of the Frida Center for Research on Violence Against Women and Children. AVA is about creating the capacity to transform population and community health and social services to promote health and wellness of girls, women, and gender diverse people at risk of or affected by violence and adversity over the life cycle through collaborative, innovative, cross-sectoral, cross-disciplinary, and cross-jurisdictional work, including our AVA online training platform and AVA webinar series. If you are not already a member, please consider joining the AVA network. The information for how to join AVA is available on your screen. Thanks, Katrina.
Thank you so much, Sarah. So on behalf of the Learning Network, Knowledge Hub, and AVA, welcome to the webinar on strengthening community responses to elder mistreatment, innovations, interventions, and lessons learned. As a start, I would like to give a land acknowledgement. I want to acknowledge that our work is located on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenapehoak, and Chinongtong nations. These lands are connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. Today, this land continues to be home to many Indigenous peoples from across Turtle Island. We give our deep respect to the first inhabitants of this land and recognize and acknowledge Indigenous land and sovereignty comes with a responsibility to understand the history and ongoing impacts of settler colonialism. These impacts continue to be felt in disproportionate and everyday ways against Indigenous communities. We also reflect on those who came to this land involuntarily, particularly those brought to these lands because of the transatlantic slave trade and slavery. We can aim to continue to work collaboratively with communities to challenge colonialism, anti-Black racism, anti-Indigenous racism, and further forms of oppression that remain pervasive in Canada and that result in disproportionate impacts of gender-based violence on oppressed communities. Today, we are very pleased to be joined by Laurie Weeks, Kathleen Allen, David Burns, and Melanie Couture, who are here to share their experience implementing interventions with older people who are at risk of maltreatment. You can find more details and their full bios in the links provided in the chat. We are going to do this as a panel discussion. So we're going to all come on together and we are going to talk about a variety of different questions. But to start, what we'd like to do is invite each project to do a little bit of a description of the work that they've been doing, and to answer the question or to talk about the gaps in community-based responses to elder abuse and intimate partner violence among older adults, and how the work they're doing is helping to bridge this gap. So I'd like to start by inviting Lori Weeks and Kathleen Allen to talk about, is that right? Yes, the AIM study.
Okay, great. Can you hear me okay, Katrina?
Yes, that's
Um,
great.
so the slides in front of me are in French. Is that correct?
So if you look at the top of your screen, and you know what, Lori, everybody will be syncing this. So if you look at the top of your very screen, you'll see English slides and deep, my French accent is so poor. You can select your language
I
at the
see.
very top of your screen.
Thank you. That's perfect. And you have to move your cursor up to the top. I just figured if I'm having this challenge of having it in the language I want, I'm sure other people are having a similar challenge. So, okay. So we'll give you a little bit of background for a few minutes about the AIM study. And I welcome my colleague Kathleen Allen to contribute some of this discussion as well. Kathleen has been the coordinator of this work and has been very involved, especially in the implementation of the work and the interaction with our facilitators and our participants in the study. So uh, basically, I'm not sure if you wanted to give an overview of this study first. Is that what you would like, Katrina?
Yeah, please just go ahead and go through your
Okay.
initial
Okay.
slide. Yeah.
Well, I'll just sort of maybe just talk a little bit about this first one, but then talk more specifically about our program on the next slide. But basically, our work is at the intersection of intimate partner violence and elder abuse. So basically, we have been very interested for many years now. Myself and various members of our research team over many years now around how do we adequately support the needs of women who are older, who are experiencing intimate partner violence, and what kinds of supports and services are most appropriate to meet their needs. So we know that there's, broadly speaking, two different types of services. Family violence or domestic violence services, and we've listed a few of those types of services on the slide here, from emergency shelters and transition houses to longer term housing, various types of outreach programs for people living in their community, and crisis lines. So we know that those services exist. One of the things that we've learned from the research that our team and others have done is that they're not particularly well geared to meeting the needs of older women. So that's one kind of element that it kind of guides the work that we're doing. And secondly, we know that there's supports through adult protection services, and these provide services and supports for older adults, typically who are defined as vulnerable and in need help and support. But that vulnerable piece is really key. So these are often very professionally driven services that involve investigation of cases that are reported and referral and case management. So again, they're very used to working with older adults, certainly. So when we're focused on older women experiencing violence, that definitely seems to make sense. But adult protection services aren't particularly well geared to support the needs of women who may not be defined as vulnerable and facing intimate partner violence in their relationship. So essentially, kind of this is all just to kind of ground you in the work that we do is really kind of at the intersection here, looking at the needs of older women who experience intimate partner violence. And we've also included here, by way of background, some of the barriers that older women can face. Some of these are very similar to what younger women might face, but because of age and cohort differences, changes in values over time, there can even be greater barriers to older women in seeking help and support if they experience violence compared to younger women. So that's just a little bit of background about why we do what we do and what kind of with the focus of our work. So on the next slide, we have a little more information about the particular project that we're doing. So our study is called the AIM study for short, and it is the advocacy intervention for women in midlife and older who experience intimate partner violence. So as part of this broader initiative, we developed and implemented an intervention, and we tested it, and we're in the process of finishing that work using a randomized controlled trial and a qualitative component in addition. So our goals were to test the effectiveness of the AIM study and to learn from the experiences of those who both were the facilitators, those who implemented the AIM program, and who also participated. So we did interviewing with the women who were participated in the program as well. So of course we've completed two of the stages of our quantitative data collection at baseline in 3 months, and we're finishing up the 9-month component of a quantitative evaluation, and we've completed many interviews as well. So that's kind of the evaluation piece, but the AIM program itself, I'll just briefly share with you some of the characteristics of this program that we developed. I always like to mention that our team, myself and other members of our team, were engaged in conducting a systematic review. And in the process of doing that, a few years ago, we identified an intervention that looked very promising. So it was an intervention that included an information sharing component and a social support component. So we adapted that intervention for our specific context where we're working. So the 3 maritime provinces of Prince Edward Island, New Brunswick, and Nova Scotia. And we adapted it for the needs of women in midlife and older. So the information sharing component, first of all, is one-on-one virtual. We were very influenced by COVID, I think, when we developed this proposal. So it was a virtual intervention as a whole, both of the components. So it involves a 1-hour information sharing session, and we've included on the slide here the 5 components that were included in that session. So including information about older women and abusive relationships. And that might seem like a strange thing to include when we're talking to women who are experiencing violence or have recently experienced violence from an intimate partner. But it's very helpful to share information about definitions and identifying abuse and indicators. That piece is really helpful for awareness raising, which is, I guess, the second point I've included here. Also, some tools for safety planning, some tools to help with decision making and problem solving, and very importantly, information about local resources. So we tailored that to the context the woman lived in each of the 3 maritime provinces had a different materials developed for that. And secondly, the second component was the social support component. And this was always very compelling to me. And again, as we adapted this from a previous intervention, it was this piece that I always thought was very interesting. So it's really rewarding, I think, to develop this for women in midlife and older. So it was 12 weekly social support sessions, and these were approximately 20 minutes. And like I say approximately because they did range quite a bit in time. So the purpose of these weekly sessions were to be very tailored and individualized to the needs of the woman in the program. We didn't specify or have a set of topics that had to be discussed during these sessions. It was really very much about what the woman identified and wanted to talk to, or even just to talk about the situation that they were in. So that's why we called it a social support session. So it's very tailored and very individualized to what the woman wanted to talk about. That was a strength and a challenge, I think, of our intervention. So on the next slide, we have a bit of an overview of some of the results of our research, if you'd like me to share those quickly at this time. Um, so we have seen so far with the quantitative data some promising trends for the effectiveness of the AIM program. The qualitative findings have been very compelling, even though the quantitative findings are important. In the qualitative findings, they're really quite powerful in terms of highlighting the benefits of receiving the AIM program. We really felt that we learned a lot about, this was the first adoption for this population and in this particular region in Eastern Canada. We certainly learned a lot from both the facilitators and the participants about some additional components or adaptations we would like to make, which is the next phase that we will be proposing to do. So we realized at the end that the participants did not have any interaction with each other. So the intervention was solely with the facilitator, but not with each other. So we recently had a symposium bringing together people who were involved with our project, including facilitators and participants. And that was discussed quite a lot as a very positive piece that could be added. We also were very committed to trying to make sure that we were inclusive of including a variety of people with unique needs in our study, including Black Nova Scotians, Indigenous women, and people who are newcomers to Canada. We'd had some success in recruiting a diverse sample to participate in this, but in future iterations, we want to make sure that we include a diverse sample in our region. And I think that's it for us at the moment. Are there anything else you'd like me to share?
No, thank you, Lori. I think that's a really nice overview of both kind of the need, the gap, and the work that you're doing. Kathleen, is there anything that you want to add at this point?
No, that's all right. I can chime in a little later on more about sort of the trauma-informed piece and that sort of thing. So no, that's great. Thanks, Lori.
Okay. Thank you. All right, so that is, so I'll now introduce and invite our second project, which is the ARMCAR Project, and Melanie Couture to speak a little bit about this work.
Hello, everyone. Can you hear me? Yes. Okay. This is not my slide, so.
So one more, please.
Okay, that's fine. So hello, everyone. Thank you very much for this opportunity. I think it's good that we get to talk about our project, but also these really important subjects. So my name is Melanie Couture. I'm the chairholder of the research chair on mistreatment of older adults. And we decided to do an online training program. So this is what I'm going to talk about today. But first, next slide, I'm going to talk about what actually gave us the idea, or what were the underlying needs that we saw for this type of project. So I'm from Quebec. You might hear my accent a little bit. So in Quebec, recent data actually showed that 5.9%, so almost 6% of adults aged older than 65 living at home were mistreated within the last year by different people and mostly by family members. This means that's about 80,000 people per year in Quebec being mistreated. Maybe you've seen the study by David Burns that here today. So in Canada, the prevalence of mistreatment is about 10%. So there is a lot of people over 65 being mistreated per year, and mostly, like I said, by family members. And we wanted to look at a particular context, which is the caregiving context, because it has been shown that the caregiving context carries multiple risk factors for mistreatment, so including functional dependency, using home care services, low social support. And actually, in Quebec, we consider that being a caregiver is actually a risk factor for mistreatment. One thing to understand that it's super important is that not only the older adult is being mistreated, but also the caregiver, the informal caregiver or family caregiver, can also be mistreated. So when we are talking about mistreatment in the context of caregiving, we're talking about all of these possibilities. So the caregiver mistreating the older adult mistreating the caregiver, or both of these people actually mistreating each other. So that's important to understand, because this also means that um, we need to talk about it with caregivers, but not in a shameful way or in blaming them regarding the situation. So, like I said, mostly they're also being mistreated within the care relationship too. Maybe the next slide, please. Oop, it's not changing, I think. Or is it just me?
Nope, just give it a second.
Okay.
Next slide.
Okay,
There we
perfect.
go. Perfect.
So if we want to be able to help people in mistreatment situation, it is super important to kind of help them indicate that they're living or experiencing mistreatment. But there are multiple help-seeking barriers, including a lack of awareness about mistreatment. So most people don't necessarily acknowledge that they are experiencing mistreatment. So nobody's raising their hand saying, I'm being mistreated. So this is really important. Also, they don't want to talk about it because they don't want anything bad to happen to their caregiver or the older adults that are taking care of. They don't want to lose the relationship. As we know, mistreatment actually is within a relationship where trust is expected. And also, for some older adults, they don't want to be institutionalized, so they don't talk about it. They rather stay with their caregiver, even if they are being somewhat mistreated. I have also to specify that mistreatments mean violence, but it can also mean neglect. So it's not always being hit or something like that, or being screamed at. Sometimes it's that the older adult is not getting all of their needs met. So that is also something to think about. Why we chose an internet-based intervention, or to develop one, was that the scientific literature actually showed that educational programs are actually associated with an increase in knowledge about mistreatment and better identification of and reporting of mistreatment situation. But all of the studies have been done with social and healthcare workers. And also, many studies have shown that caregivers actually get improvements in their well-being through e-health intervention. And as Laurie said earlier, with the pandemic, everybody's more open to online interventions also. And it's actually efficient in caregivers and informal caregivers, because one of the main advantages sometimes is that they can do it when they have the time. So we said, why not try to develop e-learning about mistreatment in the context of caregiving for caregivers, but also for people working in community organization. And next slide, please. Like I said, there wasn't any evidence about these types of programs for these two specific types of people. And informal caregivers, like I said earlier, have to acknowledge mistreatment that they are experiencing, but also if they are having maybe questionable behaviors with their older adult that they are taking care of. So we decided to develop the program ARMCAR, so acknowledging and responding to mistreatment in caregiving. It's also, of course, available in French. It's called RAMAPA in French. So we, to actually develop the program, we did a scoping review with over 120 articles to get really a good feel of what is mistreatment in the context of caregiving. We also did a needs assessment with community organization workers to know what type of knowledge and they needed about mistreatment in the context of caregiving and what type of problems they were finding when trying to help people in these types of situations. So we have developed ARMCAR. It's actually 2 online modules. One is for everyone, so the caregivers and community workers and volunteers. And the second one, especially, it goes a little more in depth on the subject and is for community organization workers. We did a usability studies with caregivers and workers at the same time to make sure that the online version of what we were doing was going great and they were enjoying it and there weren't too many technical problems. So we were able to make sure that everything was fine. And also we did get some feedback about the content at the same time. Everybody really enjoyed it. And what was really interesting is that people who were actually workers and caregivers in their personal lives said that they watched it twice using a different lens and that all of the information was good for both of their or their personal lives and also for intervention with other caregivers. So that was actually interesting. We actually use AI to create images to accompany the storyline we were telling. We use video, so it's really multi-components kind of training, and people really enjoyed it. Even if it's an hour per module, it goes by really fast. And many people did it multiple times because they said it's really interesting, and since it's emotional, we do need some time to process the information. So the fact that it's online helps people to go back and do it again if they need to and process this type of information that's really emotional, even for the workers at the same time. So we also have to think about that. So we will be starting data collection soon for the efficacy study. So we want to know whether or not it helps with knowledge, identification, and reporting, and also if it actually changes caregivers' help-seeking behavior, so social support, and maybe health. So we're doing this really soon. So thank you very much for your time.
Thank you so much. I really reflect on the capacity and the breaking down of silos with this training, even between people and professionals. And both have talked about the importance of information and just being able to provide that information. Okay, so I would now like to introduce our third study, and David Burns will talk a little bit about RISE. In a minute, I think. You know what? RISE is a very, there we go, we got it. And you're still muted.
My apologies. Thank you for the introduction, Katrina. And it's really great to be here. And it's also really, I'm very appreciative of the Knowledge Hub putting this series on about elder mistreatment interventions and the spotlight that you're giving us to kind of amplify this issue and these important interventions, and also really amazing to hear the work of my colleagues in these other provinces and the interventions that they're doing. I want to start off just by thanking the Public Health Agency of Canada for funding this work. very appreciative of that support and could not have done it without that. Next slide, please. So this is a project that's being done in partnership with Elder Abuse Prevention Ontario. And I also want to thank all of our entire team who's working on the front lines, including Laura at EAPO, and Chanel and Steph at RISE, as well as Andrea, who's our supervisor at RISE, and of course Marta, who's the CEO of EAPO. We I think my colleagues have done a good job of describing sort of the scope of elder mistreatment as an issue. It's 10% of older adults experiencing some form each year, which is a huge number. And it's associated with very serious consequences like premature mortality, social isolation, suicidality, all of the kind of things that you might expect, but as well as ripple effects on family and people who support them. And here in Ontario, um, one of the things that we're sort of the gap that you can kind of see on this slide here that we're trying to address is that I want to be very clear to acknowledge all of the great work that people are doing out there in the community, and in identifying older adults who are victims of elder mistreatment and providing them with support. Um, and oftentimes this work is being done, however, on a volunteer basis, and or it's being done like at the side of their desk, kind of. It's not really a part of their core role, but they're doing because they're good people, and and certainly there are some programs out there that are doing amazing work as well. But what we lack in the province is sort of a coordinated and dedicated response system to this issue. Sort of like response systems that are in place for other forms of family violence. And that's sort of what we're trying to address here with this project. Sometimes when I'm doing presentations, I'll ask people, like, do you know who you would call if you had a parent or a sibling or a grandparent who you were worried about? And most people don't know who to call, and that's a problem. So that's what we're trying to address here. Next slide, please. And so RISE was developed over a period of years, based on prior research, theory, and consultations with survivors of elder mistreatment. And when we spoke to survivors, we learned some very powerful kind of messages from them that, as you can imagine, that they're coming into this um, as victims of mistreatment with pretty powerful feelings, for example, of embarrassment, shame, self-blame, guilt. You have to remember that a lot of the time the harmers in these cases are children. They're adult children or their grandchildren, and in some cases their spouses or friends. But in a lot of the cases they're their adult children. So it's a bit different, and it's very complicated because they take on a lot of the kind of guilt and blame themselves. um, they also are then concerned about their harmer. They want their harmer to get support. They don't, you know, and so so all we learned all this, and one of the things we definitely learned is that they're often looking to sort of repair harm and restore family harmony. Not necessarily take sort of a punitive or kind of criminal arrest or prosecutorial approach as the default. And so it became clear to us that if we're going to design some kind of intervention, ideally it needs to go sort of beyond sort of your standard case management, but have a more kind of a greater capacity to help people work through some of these psycho-emotional challenges, and to try to the extent possible and when appropriate to sort of take more of a restorative approach. Um, and so we do take a very relational approach in our work with RISE. It starts between the relationship, but we call them advocates, the caseworkers. There's like a long sort of engagement period to develop a trusting relationship so that the older adult is open to working with us. We take a cultural humility perspective and taking a very client-centered approach, and we're sort of respecting cultural values and sensitivities around that. And then we also value like the idea of restoring a relationship, again, when appropriate and when it's what the older adult wants, restoring the relationship between the older adult and their harmer and working with the harmer to provide them with support. And then we do a lot to bolster social support around them. I think as one of the other presentations was mentioning, social support is arguably the biggest kind of protective factor in these cases. And so you can see the model here, and RISE stands for a couple of different things. One is that it reflects that we try to work at these different levels of influence. So at the relational, the individual, the social, and the environmental levels. And then it also reflects the core modalities of RISE. So when working with individuals, we use motivational interviewing, which I'm sure a lot of you are familiar with, but basically it's a technique to help people become more open to the possibility of change. And then when we're working with them as a relationship, we take these restorative approaches. We use something called teaming to try to bolster social support around them, and then supported decision making to try to empower their choice making and respect self-determination. So we work with older adults who are age 60 years or older, and then we try to take both a prevention and a response role. So we work with cases who are either at risk of mistreatment. They may not have yet escalated or kind of bubbled up to the point of actual mistreatment, but there's a lot of concern there and red flags. And without support, it might go up. So we work with cases who are at risk of, or cases who are experiencing actual mistreatment. Um, and um, we first started this in Maine in the U.S. actually, and piloted it in a couple of different randomly selected counties. And based on that kind of evaluation, what we found is that cases that were exposed to both RISE and the Adult Protective Service System down there were significantly less likely to come back into the system. And sort of that kind of recurrence rate. And then based on that, it then got scaled throughout the state of Maine, and has since been rolling out in a few other locations in the US. Next slide, please. But I want to talk more about what we're doing here in Ontario in this project. I'll just wait for the next slide there. We're trying to set up sort of like this response framework. And so the way this is working is that Elder Abuse Prevention Ontario now has like a centralized line where anyone from across the province can call in. And so we get calls from older adults themselves, concerned family members, service providers. They call into this line, and then there's this sort of initial consultation and screening process that's conducted by EAPO and their consultation specialists. And then if the case is eligible, they meet certain criteria as to like the types of mistreatment that might be going on, and there's a cognitive screen. They get referred to RISE. And I have to say that, it's just, this partnership with EAPO has been, I think, very like complementary, because EAPO has this very deep and extensive sense of reach across the entire province of Ontario, with approximately 43 networks of people who are working on these issues. And so they've, really been able to get the word out about this, and then we kind of can bring this sort of like intervention to complement that awareness. And so we get referrals, and then we implement the RISE model with these clients. Next slide, please. And to date, we have we've worked with about 125 cases, and we initially started in the GTA, but kind of very quickly realized that there was a need for this across the whole province. So we have rolled it. One of our challenges, I think, has been reaching kind of northern parts of the province, and that's something that we're aware of. But we've been working with cases, in all sorts of communities across the province, both in rural and urban settings. And then we use in person when it's kind of geographically feasible. We operate out of Toronto, and then telephone or virtual service kind of modes of delivery. Next slide, please. And so far, so this is being done in the context of a randomized controlled trial. And so we collect data at the beginning of the intervention, and then 3 months into it, and then again 3 months later at the 6-month mark. from both the control and the treatment arms. And the control arm consists of people who receive like sort of a 45-minute or so consultation at EAPO that includes like referrals and so forth. And then, of course, the treatment group receives the RISE intervention as well. And so these are preliminary findings. So far, we have at least these results that I'm showing today are based on 53 people who have had all three points of data collection. And when we do the analysis on these cases, comparing those in the treatment and the control groups, what we're finding is that people who are exposed to both the EAPO consultation and the response model, the RISE response model, have significantly greater improvements on the outcomes below. So emotional support, informational support, perceived stress, problem concern, social interaction, self-efficacy, general self-efficacy, and total life satisfaction. So we're really excited about this, and it's certainly a big undertaking, but it does seem to be working, at least as it relates to these outcomes, and looking forward to continuing the work. Thank you very much.
Thank you very much. And you know what, this is a really nice way to think about the multiple different touch points, all the way from how do we provide people themselves with information and those networks of people who care for people, as well as the caregivers. And then once we provide that information, how do we actually get a response? So I'm actually going to have our slide people do something a little bit complicated. I'm going to ask them to put up the slide that we slipped by, and that was a slide that really spoke to this issue of power imbalance, because one of the things that all of the presenters have talked about so far is the complications about addressing maltreatment and violence within caregiving relationships that include family members and intimate partners and others that are very close. And so the question that I want to ask is about really how do power imbalances and dependencies influence maltreatment, and how can we start to think about that when we're thinking about interventions? And so Lori, I'd invite you to speak to this slide around this work.
Oh, okay, sure. I did skip over it. It was our slide, but I felt like I had done enough of my introduction to our project. Is my video on?
Yes, it's all great.
Oh, okay, good. I couldn't see it. Okay. Yeah, sure. Thank you. Sorry for skipping over this. So some of you who work in the field of domestic violence may have seen this or a similar diagram. So there was a slightly different one developed, focused on domestic violence. And then later on, this one was developed specifically focused on abuse in later life. So sometimes I don't have the other one here on this slide here, but they're very similar. And that's often one of the things that I like to point out when we're talking about intimate partner violence in later life. A lot of the same dynamics in relationships are the same. Whether no matter what age you're talking about. And I think that's a really important point, because most of the focus in domestic violence has been on younger women. So just really briefly, power and control in a relationship is at the center, figuratively in this diagram. So essentially the idea is that power and control is obtained and maintained over another person through various methods. So those are the methods that are in kind of the pie wedges and the spokes around this wheel. So, threatening a person, financially exploiting them, using privilege, isolating them, targeting whatever vulnerabilities that person might have, and neglecting a person. So anyway, those are just some examples of the way that a person can obtain and maintain power and control over another person. In the domestic violence literature and kind of conceptualization of this, all those different tactics can be used, but they can be exhibited in different ways. Kind of those, what we sometimes think of forms or types of abuse. So emotional, physical, sexual, those are verbal, psychological. Those are all different ways or different forms of abuse, but different tactics can be used in different ways to obtain power and control over another person. I do find in the domestic violence literature, there's a little less focus on trying to identify and define the different type or form of violence that's occurring, because it's essentially an abusive relationship where there's power and control dynamics happening. I find in the elder abuse literature, it's really interesting to be part of this discussion, and with the two other projects funded through Public Health Agency of Canada from this particular initiative on focusing on older adults. So it's also, I agree with the others, it's fabulous to be part of this initiative and focusing on later life. In the elder abuse literature, there tends to be more focus on trying to define the different form of abuse, but but less emphasis on the ways, excuse me, a little less focus on that it's an abusive situation, and in a lot of times there can be multiple forms of violence or abuse happening in the relationship. So as I said, our team kind of works at those intersections of elder abuse and domestic violence. But yeah, that's basically what this diagram depicts.
Yeah, thank you. And Melanie, I know that some of the ARMCAR material speaks to also the different kind of contexts of relationship of violence maybe happening at different times or continuing or escalating. Do you want to speak a little bit about the different ways that violence can show or abuse can show up?
Yeah. Well, within like I said, the caregiving relationship, sometimes it's actually domestic violence that's just continuing. It's already been there. It's just escalating because of the stressful situation of because caring for someone who is having health problem brings tension, frustration, and everything. Um, Sometimes also you have to take into account that the caregiver is not choosing really to be the caregiver. There's a lot of pressure from other family members, sometimes from the social and healthcare system, telling them you have to be the caregiver. So you have to be careful, like I said, about judging the caregiver who is mistreating, because they are also being pressured and mistreated. The other thing we have think about, the literature have been showing right now that if you see somebody that is really frustrated, so a caregiver that's really frustrated, we're talking about power imbalances. In fact, we often think that the person who is dependent actually doesn't have that much power, but usually the caregiver also feels powerless. You have to think about that when you take on the caregiver roles, you have to put aside some of your life's objective. And it's not maybe for 20 minutes, it might be for years. So you're putting aside a part of your life. And at one point, you may be only a caregiver and you don't have time for anything else. So they do feel they don't have power. So there is also this type of power issue also when you're a caregiver. And this brings on frustration. And then if you're frustrated, you're caring in a way maybe that's not appropriate. And at the same time, if also the older adults you're taking care of is frustrated because they're sick and they're being not nice with you also, then it brings on a real tension within the relationship. So overall is that you have to take into account the needs of everyone and the different power imbalances that are being created within the caregiving relationship when you are intervening in these types of situations. So really need a need assessment for older adults, but a need assessment for also the caregiver to be able to have the whole picture, because everybody's suffering when there is mistreatment, not just the older adult.
Yeah. Yeah, and David, I'm gonna I saw you nodding around there. I imagine that
Yeah.
there's some really things and what I'm thinking about is, the fit or lack of fit, maybe in terms of there's been a lot more conversation recently and a lot more education around coercive control. And we often talk about coercive control. You really need to kind of figure out who is the one that has the power. But it sounds like there's some additional complexities here.
Yeah, and you know, I really appreciated what Melanie was saying there in the caregiving context, and you know, I'll highlight another kind of maybe similar situation because I think in cases of elder mistreatment, the power imbalance and the dependency can actually move in both directions, and so one of the common case scenarios and one of the more complex and complicated and difficult case scenarios that we see with Rise is the scenario in which um, an adult child is living at home and dependent upon an older adult, you know, often with some kind of mental health issue, and sometimes very serious mental health issue, and you know, and they're unemployed, and so you could almost argue that like the dependency is going from, you know, in that other direction, and um, similar to what Melanie was saying, it's sort of like that really fosters this environment where they become sort of resentful and frustrated with that situation, and they lash out on the older adult. So I mean, I think that is something that, you know, like is very common, and then certainly like, you know, I think as it relates to older adults, maybe some things that might be unique, you know, additional uh, sort of identities that might contribute to power imbalances, you know, sort of like things related to ageism and you know, you know, disability or functional abilities that associate, you know, with age that might contribute to their vulnerabilities as well.
Right. Well, and so I'm going to stick with you for a second because I know that one of the things that you described in terms of the RISE model is really using a restorative lens and empowerment models. And also we'll kind of bring in trauma and informed or trauma and violence informed. But I'm maybe starting with you around the kind of restorative approach. Can you talk a little bit more about why or how you think that kind of approach is so important in this complex power dynamic place?
Yeah. Yeah, I mean, what we find again, because of this sort of you know, sort of almost unique dynamic to a lot of types of elder mistreatment, where it's like an adult child or grandchild harmer, you know, and for those of you who are parents out there, I mean, you might be able to understand, like, it's, you know, like you're very you don't want to kind of implicate your child in like the criminal justice system unless you know, like, I mean, that's sort of like a last resort situation. So often what they're fine what they want is to get support for them, and to and if possible to repair that relationship, and so that's sort of where it comes from. And you know, what it does is it sort of shifts the paradigm away from like that kind of default punitive approach, which, you know, by the way, I mean, and I think my colleagues did a great job of describing this before. A very small proportion of victims of elder abuse ever even come to the attention of formal supports. You know, it's only like 15% of them, and so part of that is if they think that it's going to be a kind of a punitive response to their harmer, they're not going to come forward, right? So taking more of a restorative approach, we hope, encourages people to seek support. And it sort of recenters things more towards sort of a family-based approach that centers the wishes of the older adult and what they want. It kind of embraces those kinds of like values of self-determination and their choice and their control over what happens in the process, as opposed to, you know, some of the potentially re-traumatizing impacts of what can happen in the criminal justice system. Now, of course, if they want to pursue a criminal justice and process, I mean, we certainly support that. I mean, that it again, it's kind of, it comes down to what is their choice. Um, but I think the other thing about a restorative approach is that it also allows and provides older adults with permission to hold multiple truths. So, meaning that, you know, on the one hand, they're allowed to acknowledge that what's happening to me is wrong. Like, this is not right. But on the other hand, they're also able to kind of hold space for that reality that, like, it's wrong, but I don't, I want to help my harmer. And that's a very common but kind of complicated tension that we see.
Well, and you know, it to me, you know, as you describe that, it speaks to somebody who asked a question like the kinds of tools of balancing and resolving this tension, and one of them being, you know, supporting and empowering the holding of two different perspectives at the same time, and not kind of being pushed to one or the other. Um, Kathleen, I think you also have some thoughts around the really use of trauma and violence or trauma informed approaches with this population, and what in your work, how is that important?
Yeah, thanks, Katrina. Yeah, I was going to talk a bit about kind of like the strengths and challenges that we experienced with the AIM project. Um, so we worked with our facilitators were professionals who already had experience with working in the field of family violence, delivering programs, that sort of thing. So they brought in a lot of knowledge and experience in working with these populations. But we found that using a trauma and violence informed approach really allowed the women to feel heard and feel that their experiences of abuse were validated, which unfortunately, working with the participants, it was quite obvious that a lot of times that wasn't always the case. So sometimes reaching out to other sources of support, both formal and informal, um, sometimes there was a lack of response or lack of validation of the abuse. So, and talking about women in midlife and older, sometimes these our participants had been in abusive relationships for up to 20 or 30 years. So, there's a lot of impacts to their self-worth and that sort of thing. So, I think really our research team and our facilitators spend a lot of time being really sensitive to that and really, um, you know, providing encouragement in our program and validation. It really was, I would say, a strength to our program and did kind of lend to the some of our positive outcomes, I believe. So we did see resiliency in our participants. And we think that had a lot to do with the way that we delivered the program in a trauma and violence informed way. The participants developed a trusting relationship with their facilitator, which enabled them to focus on personal triumphs and strengths during the process of recovering from an abusive relationship. We found resilience was fostered in many ways. Participants were encouraged to connect with the community and try new things, like, for example, joining social groups. So again, I think one of the ways that we did the trauma and violence informed approach I'm speaking sort of the facilitators working with the participants, they really focused on really even just very small triumphs. So, sometimes just leaving the house even once a week is a goal that participants are trying to achieve. Some, it was joining a social group, or even just working on maintaining like personal boundaries and relationships and self-care. So, you know, kind of it was participant led. So really whatever goals they might have, the facilitators were really great at supporting them, but really focusing on those small triumphs. And connecting them to, other sources of support or programs that they may benefit from. And then I guess one of the challenges that we encountered with supporting these women was that the barriers that they're facing on a day-to-day basis. So um, facilitators encouraged and supported women as they're going through like various formal processes like court proceedings. Unfortunately, there was kind of little that other than, supporting and encouraging through processes, we weren't able to address some of the larger like structural barriers that women encountered. So there was all kinds of things that came up throughout the study, like lack of support or response from law enforcement or victim services, costs of legal fees, long court wait times, that sort of thing. So we found there was a lot of barriers, still a lot of work to be done, but the support that women receive can be quite instrumental in like getting their healing and leaving the process, or sorry, in the process of leaving an abusive relationship. Does that kind of answer your question, or is there more I can touch
Yeah,
on
well,
with
you know
that?
what, Kathleen, what I'm kind of reflecting on is kind of thinking about, again, the diversity of situations, right? And my heart is kind of I'm just sitting with like working with somebody who's been, it's a 30-year experience. And to be able to provide some empowerment and some hope, it's, I wish it happened earlier, but it's never too late. It's always the right time to kind of provide kind of that support. And some of those stories are echoing through. And where sometimes, in fact, it's the turning point into older adulthood can be that turning point that provides an opportunity for someone who's been for support, and if we can use it. But as you ended off, there's structural barriers, and I wonder if I could turn to you, Melanie, to talk a little bit more about some of those kind of structural barriers around help and trying to provide service in this context.
Well, so the ARMCAR project, we decided to go with a trauma-informed approach because the idea was to also give tools to the community organization, because the subject, the people working in community organization kind of feel uncomfortable with the mistreatment situation. Um, so in the context of caregiving, and so they needed help to to be able to support the caregivers they were giving services to. So of course, one of the risk factors for mistreatment is actually prior victimization. So it means that people usually, and we were talking about intimate partner violence too, so usually it's maybe not the first time that these people are living through experiences with violence and mistreatment. So it's important that we can actually create somewhat of a safe space within these community organizations. And one of the first steps is actually, and this is how we're going to implement also the ARMCAR project, is that the first month it's the whole organization that's getting the e-learning module and the training. So they are ready to support the caregivers that are going to take the online training the second month. So, and both of them will know that they did the training. So they'll be able to talk about it and say, well, remember this slide or this information? It got me thinking, it got me. So they're getting the same information with the first module. Of course, like I said earlier, the workers will actually get even more information with the second module. So the idea is to create that type of environment when we can talk freely about mistreatment, and also that they know that sometimes when people refuse services, because that's where most workers are uncomfortable, they know why, and they know that they need to be patient, take more time, and that it's somewhat normal with this type of situation, that people don't say yes right away services. And like David was saying earlier, they kind of need time to process. They're ambivalent about everything about the situation. And so this gonna help to give better support to these types of people. So the trauma-informed approach is not just about how we developed the training, but also giving more tools to the community organization to be able to support people who have been through violence and trauma also.
Yeah. So I really love the way we're kind of emphasizing that there needs to be multiple different levels of change, right? So it's useful to have individual supports and empowerment, but if the caregivers around or the professionals around don't have that information, then people won't get response. And then I'll go back to David, because if there's not a system of response, then, and you can't get to anywhere, then, you may be able to hear something, but how do you get a police, if you need police response, or how do you get a non-putative or non-justice system response? And so, David, I wonder if I can turn to the question about sort of policy changes. What policy changes do you think are needed to better support older adults experiencing abuse? And maybe even how research projects can contribute to that. And I see somebody in the questions has asked about, what quality of data do we have the right quality of data? Like, what do we need to, so back to what policy changes and how could research contribute to that?
Yeah, that's a good question. I think um, in most provinces across Canada, there needs to be more kind of policy and sort of resources that are dedicated towards a response system for this issue. I mean, it's not where it needs to be at this point. And I think there's, over the last several years, there's more and more attention being brought to the issue, and how important it is, and how we need to respond to elder mistreatment. But it's I think we need to get to a place where there are resources that are dedicated towards setting up appropriate systems, and I think all of these projects are producing high quality data to help inform what those systems can look like. um, and then I think so that's kind of the response end. I think on the other end, kind of upstream, there's really not much happening from a primary prevention, standpoint, in terms of, like, we've been kind of talking about, well, perhaps some of the work that my colleagues are doing are getting at primary prevention, but I think more of an effort could be also like, what can we do to prevent this from happening in the first place? And then certainly, if and I know that the government is putting resources toward this right now, but sort of some kind of standardized data collection effort across provinces, so that we can get a better sense of, a better picture of this issue, of like, what do the cases look like that are coming into systems that we develop, and what's working, what's not, that kind of thing.
Lori, Melanie, or Kathleen, do you want to add to the question around that?
Yeah, I can start and others can chime in. I guess just thinking of policy responses, I really I was thinking of sometimes with older women who have been in their home and community for a long time and have a social network around them, support network. Um, just simply leaving the home and moving somewhere else isn't always the right answer. Not in the current study, but previous work our team did a few years ago. We really heard that loud and clear from women, and especially who lived in rural places. That was just the focus of that work. But that's a different approach, I think, than a lot of times with working with younger people. It's just getting them out of the situation into a safe place. But yeah, we heard very strongly that, women have often very strong attachments to their land, their possibly animals, community, so, and all the human supports around them. So that's something that is it really needs to be considered, I think, when developing appropriate responses and interventions, that it's not always about the woman leaving the particular setting that they're in. They want the abuse to stop. They just don't want to have to leave their home and community to do that. But on the other hand, if that is the desired goal of the person, so from a very person-centered perspective on what the goal is, there's just not a lot of options for affordable housing that is safe and permanent. I was able to spend some time on my last sabbatical on the opposite coast, so in the lower BC mainland. It was fascinating to learn about some of the specific services that are developed. A very different context than us in the Maritimes, but a bigger city and different resources that's provided by the province and the city, I believe, to fund some of these things. But I was able to interview women who lived in permanent, safe, and deeply affordable rent geared to income housing. Two of the buildings were specifically designed for women who had experienced violence in intimate relationships, but through talking with them, often there was violence in multiple contexts throughout their lives. But there was buildings specifically designed for them to live in that were for women who were 50 and older. And then I interviewed women in a third building that was for women of all ages, but I specifically talked to the older women that used those services. Those are things that I see very lacking in a lot of other places in Canada, where the housing is deeply affordable, geared to income, is safe and permanent. We have short-term housing, but that permanent piece is really lacking. And then the other part I really learned was that these are buildings that have staff. It was basically supportive housing. So having people there that can provide whatever assistance and support, and linking them with other services in the area and such things. So it was great that it was a Canadian example of some things that are happening in another city, and it was, and I still don't know exactly how to translate that into other locations, but it was really, really important to learn about that. Actually, the work that has just been published online in the journal Violence Against Women, so it's just available now publicly. So those are just a few things I'm thinking of in terms of, they're not easy. I mean, the responses are not easy to implement, but it's always helpful, I think, to see examples of what could happen and, examples from other locations to see how we could adapt them.
Yeah, and so you were talking about sort of some of those just straight structural aspects, and I do want to just take a moment to mention that actually on June 24th, we're hosting a webinar which is really about confronting Canada's housing crisis and advocating for change. So we're going to delve into that a little bit more because it touches everything, right? It touches all populations, but I also think about the specific challenges for older Canadians who may need spaces that are affordable and deeply affordable, and a different kind of support sometimes as people age, where different kinds of resources are available, and how possible or how prevalent or how available or unavailable are those kinds of services. Melanie, did you want to add anything around this question of what kind of policy changes or how research can contribute?
Well, actually, in Quebec, since 2010, we've had three government plans regarding mistreatment. We've been slowly making a structure to support people experiencing mistreatment. So we have a helpline. We have a mandatory reporting now. We've got government training. We've got a lot of things in place. The thing that's still missing, and that's why we developed the project about mistreatment in the context of caregiving, is that we've got things for the kind of the general or generic mistreatment, but we need more information about and specific context like caregiving. It's really different how it manifests compared to maybe a mistreatment in nursing homes. So we need more specific intervention and information, like I said, just to identify it. It presents itself differently in different contexts. So we need more information about that. That's why we did the project. And like I said, there is necessity, since we have action plans, we do have funding. But there is also a need for funding for research. We actually just got a grant for mistreatment, organizational mistreatment in living environments for older adults. But you need funding for research, not just intervention. And also, me and David already talked about that, but the intervention part is still not clear in Quebec, how to intervene. And that's why we're thinking about maybe trying to also implement the RISE within Quebec, because intervention, it's still hard. People don't know what to do exactly. And so we might need that in the future too.
Well, and I think I want to lean into an intervention question because, somebody asks about kind of the complexities that are involved when the adult child was a victim of child abuse at the hands of the current elder, but now is in a caregiver role. And I guess I think of my guess is I can think of examples. My guess is that's not super uncommon. And maybe that child had escaped, but now, or kind of escaped in the sense that they'd left that abusive and now they're kind of back in a caregiver role. And does maybe I'll turn to you, David. Do you any kind of thoughts around some of those kinds do those cases exist, or are they some of the
Yeah, of
complex
course.
ones?
Yeah, no, I think that's a really good point. And it's interesting that you bring that up because just in the last sort of 5 years or so, there's more and more evidence that's coming into play that like that this really is like a life course kind of issue in a couple of ways. One is that these kind of three main types of family violence: child maltreatment, IPV or DV, and elder mistreatment, are linked. So if you experience child maltreatment at an early age, you're significantly more likely to experience elder mistreatment at a later age, which is fascinating, right? We don't know like what are the mechanisms that link those things, but that's one. And then the other is what you've just mentioned is that like this kind of intergenerational kind of transmission of violence of like if I was abused as a child, I'm more likely to abuse my parent when they're in a, you know, as a when I'm a caregiver. And I think these are really interesting questions that have to be asked, and examined a lot more. And probably like as we move forward in, you know, family violence in general probably needs to come together a bit more, and um, you know, kind of try to think about this from more of a life course perspective. And um, and just back to the policy thing, I just another thought. I think, you know, like probably just, you know, governments from different jurisdictions across the country, it would be good to kind of come, you know, together more to kind of to work with us. I think we do have like some of the expertise that we need to answer, you know, start beginning to answer some of these big questions that we're talking about.
Yeah. Kathleen, oh, sorry, you just went off and then I bugged you. Do you, just any sense in terms of, in when working in groups of some of those, any other thing that you want to add around those sort of complex maybe multi-generational patterns that you need to start to talk about? Um,
Sorry, would you mind repeating that question, Katrina? I just had some background noise there.
Sorry about that. I didn't mean to. It's like
No,
when somebody puts food in their mouth and then you ask them a question at the same time, right? Like you can't do it that way. But I guess I was wondering from running groups, do you have any other any reflections about, you know, how often or how things come up where there's those complex multi-generational aspects of abuse that might be present?
Yeah, so that did come up in some of our qualitative interviews with participants. So they did discuss a lot of childhood trauma as well. So not just, sorry, my kids are just getting home from school and they're not aware that I'm on a webinar. Some childhood abuse, which led to getting into multiple adult relationships that were abusive, unfortunately. So I mean, not for all participants that it was sort of like this long-term abuse, but for quite a few that did come up. So I know our intervention, it sounds kind of long, like a 13-week program, but to really unpack like lifelong complex abuse and trauma, it was, you know, it was a lot. So I think, you know, there's a lot more obviously that could be done to support people in those positions or those with those experiences, but we kind of, I guess, scratch the surface in a sense, you know, offering them support, but there's a long ways to go for sure. But yeah, there was definitely, like Dave said, a life course approach is definitely appropriate for this research as well.
Yeah. Okay, I have a very specific policy question, or I think a kind of specific policy question, and Lori and Melanie, I'll throw it to you, but others can answer it as well. And people are bringing up this challenge, I think, around being in the hospital and needing hospital services, and sort of a mandatory reporting kind of strategy or around intimate partner violence or abuse or neglect, elder abuse, and then sort of an inability to go home, which maybe some people want. Like, is there something? Have you experienced some level of challenge or gap in the hospital to community or hospital to home context?
You want me to go first, Laurie?
Go ahead, Melanie, yes.
Yeah. Okay. Well, in Quebec, the mandatory reporting, it's only for specific context. So people who have who are inapt, so they have really bad cognitive deficit. It's, you know, but and also if people are living in seniors residence and they are considered in a vulnerable situation, which means they may have problem getting help, then there is mandatory reporting, or people living in nursing homes specifically. So it's not mandatory reporting overall. I have seen some resistance from workers because they want to keep a relationship with the person, and they don't want to report if the person doesn't want to. So sometimes they do take a little more time to convince the person and do get consent before reporting. Sometimes people are afraid of reprisal, so they rather not do the mandatory reporting so they don't get anything bad that happens to them or to the older adults who is experiencing mistreatment. So yes, and a lot of people don't even know they're supposed to report. So we've been working with some professions like dental hygienists. They actually have to in Quebec, so it's really important to take the time to implement it and give information about people, because they also want to know what happens next. So if I do the mandatory reporting, what will happen? So you do have to inform to reassure people so they actually do it. So I work a lot of implementation of program implementation, and it takes years usually for people to know about it, feel comfortable, and do it. So we have to be patient. But it is necessary in some instances because the person cannot report. So we do need somebody else to be able to report, or nothing's gonna be done, and it's just gonna escalate anyway. So we need people to be able to report in some situations. Go ahead, Laurie.
Well, thank you for that, and thank you for the question, Katrina. I just want to reiterate that it's very important for health professionals or any professionals to know in what context they need to report. And as Melanie said, it can vary much by jurisdiction, which is very interesting. Between often provincial or territorial jurisdictions have jurisdiction over this kind of area of policy. So it's very important to know in what contexts and situations it's required to report. Sorry, I'm talking fast. I need to slow down. It's very important to make sure that people who aren't vulnerable, according to those official definitions, however that's defined, physical and or cognitive vulnerabilities, if they don't fall into those categories, it's very important not to take away that right from someone to choose to seek help or not, and under what situation, what timing, what context they want to do that. So it's just a very important question. I'm very glad that you raised it, because for a person who is not ready to seek help, not ready to share that, it could cause a great deal of harm. So I think that that's a really important point, and that issue of vulnerability and the definition of vulnerability is very important for professionals to understand.
All right, we are almost to the end. What I'm going to do is I'm going to give you each 30 seconds or a little bit more for a key takeaway that you want to give our audience. I'm going to start with David, and then Kathleen, and then Melanie and Laurie. And so your final kind of key takeaway that you wanted, I know all of you have many, and I certainly have many coming out of this, but David, what would you like to close with?
Well, that's a very generous question. I guess we're really excited about the work that we're doing here in Ontario with EAPO, and the preliminary findings. It seems to be working, and so if anyone's interested in sort of learning more about what we're doing, please feel free to get in touch. And I think some of the takeaways, sort of like, we don't want to the extent possible, sort of override client choice, but more like kind of listen, take a client-centered approach. And what we're finding is that when you do promote kind of agency and sort of like self-determination, that seems to work better, um, and sort of have this flexible notion of what success looks like, because again, that could be very client driven.
Yeah, thank you.
Yeah.
Kathleen, your final takeaway.
Yeah, I just got a couple, but it won't take too long. So yeah, I just wanted to touch again on the barriers that we discussed earlier. So there's, barriers for women of all ages who might be seeking refuge from an abusive relationship. But I think we, can argue that older women are facing unique barriers based on, their age, generational factors, and their long-term abusive experiences. And just kind of generally as like a overall kind of finding, we found that, providing an intervention that supported and empowered women was quite instrumental for fostering resiliency in the women. But again, this support is limited in that it can't ameliorate, the broader kind of structural barriers that women are facing. So there are some other key supports that are needed as well, like we mentioned, the peer support, as well as help with navigating like the various systems and supports that women come in contact with, and then expanding, financial and housing opportunities as well, as Lori already discussed. So that's, yeah, that's kind of our key takeaways, I think, or my key takeaways. Thanks.
Perfect. Melanie?
I would say never judge the perpetrator. Okay. Usually these people need help, and you never know if you would do the same thing in their situation. So don't judge. You don't know what people are going through. I always say mistreatment is bad strategies. So just help people find adequate strategies to face the situation, and usually they will do better. Mistreatment is often unintentional. People don't want to hurt other people. Of course, there are exceptions, but mostly they are open to doing the right thing, but they are in pain and need help too. So that would be the main takeaway, especially, like I said, caregivers who mistreat, don't judge them. They're going through some difficult times and they need help to do better.
Thank you. And Lori, you get the last word.
Well, that's a big question, a big responsibility. I would just say from kind of for our work as a whole, we really want to kind of work towards making sure that there's appropriate supports available to meet the needs of older adults who are experiencing intimate partner violence. And I guess I would love to see, I mean, David talked about kind of the three kind of groupings of services: child, domestic violence, and then elder supports. And I have always felt this should be not so separate and somehow more integrated. I think that the knowledge people have, and they're like, we would do better to kind of share information, resources, and services amongst all of these areas versus having them very separate, I think.
Thank you all. Thank you to Melanie, Lori, David, and Kathleen for sharing all of your valuable insights. Thank you as well to our ASL interpreters, Carmel and Joanne, to our LSQ interpreters, Lynn and Jean-Francois, and to our French language interpreters, Wendy and Carolyn. Thank you very much for joining us. As a reminder, when the webinar closes, you will be linked to a little survey, and please complete the evaluation form to receive a certificate of participation. On behalf of the Learning Network and the Knowledge Hub, we look forward to welcoming you to our future webinars and events. Don't forget to sign up to our mailing list to stay informed. And as I already mentioned, our next webinar is going to take place on June 24th, and it is entitled Nowhere to Go: Confronting Canada's Housing Crisis and Advocating for Change for Survivors of Gender-Based Violence. Thank you, everyone, for joining us today. Goodbye.